HIV stands for Human Immunodeficiency Virus, and it is a virus that attacks cells in our immune system. Our immune system is our natural defense to fight off infections. HIV destroys white blood cells called CD4 or T cells in our immune system. As HIV destroys more of these cells, it weakens the immune system, which makes it harder to fight off infections and diseases. Previously, if someone contracted HIV, it was only a matter of time before they developed AIDS. This is no longer the case due to the antiretroviral treatment that is on the market. HIV is a sexually transmitted disease, but it can also be spread by contact with infected blood, such as sharing needles, and through pregnancy, childbirth, or breastfeeding. Basically, it is transmitted through bodily fluids. When HIV first appeared in the United States, it mainly affected men who had sex with men, although now it is also spread through heterosexual sex. Those that are at the highest risk for contracting HIV are gay and bisexual men. Injection drug users are also at a higher risk for HIV. Young people are at risk due to experimenting with sex and drug use, and older people are at risk due to unsafe sexual activity. In 2017, there were approximately 36.9 million people living with HIV, and that was up from the 32.4 million in 2010. Eastern and South Africa have the highest number of people living with HIV at 19.6 million, or 53% of the HIV cases. Western and Central Africa are second with 6.1 million, with Asia and the Pacific following in third at 5.2 million. In the United States, there are approximately 1.1 million people living with HIV, and 1 out of 7 don't know they have it. In the United States, California has the highest number of cases, with Nevada following second. Although California and Nevada have the highest number of cases, the cities that lead in the highest rates are Baton Rouge, Louisiana, and Miami, Florida. Behavioral factors associated with the spread of HIV are the high-risk behaviors such as not using safe sex practices. It has been found that homosexual men living in open, active communities have shown a decrease in the spread of HIV, while those living outside a gay community or those without social ties and/or bisexual men are still showing an increase in HIV infection. Having sex outside of a relationship is a factor, as is the use of drugs among any person. Peer support is extremely influential in behavior change. Environmental factors include poverty and cultural traditions such as religion. The people living in poverty may engage in transactional sex in order to receive material goods. When people are living in poverty and having food insecurity or inadequate diet, it may affect the immune system in fighting off infections and diseases. In areas where the cultural traditions don't allow women the right to say no to sex or safe sexual practices, can increase the chances of becoming infected with HIV. If a person with HIV doesn't take the antiretroviral treatment, it can develop into AIDS. When a person is sick with AIDS, the cost to take care of the disease increases, and if they are not able to work, they may lose their job. They may have to sell off their belongings in order to pay for medical costs, which can be very expensive when treated appropriately. When people become sick, it can affect their mental health, which then may increase the need for health care in not only the HIV treatment, but also the mental health treatment. This can have a severe impact on the economy. In the United States, medical information is considered confidential and protected under the law. Due to the sensitivity of HIV, many states have adopted additional laws to protect HIV medical records. Most of the time, HIV cannot be disclosed with general release of medical records, and specific HIV authorization must be obtained. There are exceptions to this legal and ethical obligation of HIV, which includes that a medical provider has a duty to report HIV and AIDS to public health authorities. Medical providers may also be permitted to disclose a person's HIV infection without legal penalty to another person if they are at risk of being infected. Some states may require that the provider warn the HIV-infected person before they disclose the information to the person at risk. In the political aspect of HIV, there is a federal action plan for the National HIV/AIDS Strategy in the United States. The federal action plan outlines specific steps they will take to implement strategies to improve HIV prevention and care outcomes. The Joint United Nations Program on HIV and AIDS launched an aggressive target to end the AIDS epidemic by 2030, so that no child will be born with HIV. There is also a World AIDS Day that was declared for December 1st. The future of HIV has a positive outlook due to testing and the antiretroviral treatment that is available. We have already seen a decrease in people being diagnosed with HIV. In 2013, the CDC stated that prevention efforts had already averted more than 350,000 HIV infections. The more we address this issue publicly, the better our chances are of continuing to decrease the number of people testing positive for HIV. We can't allow HIV to be a disease that people don't want to talk about. If we talk openly and without shame, we can only increase the chances of putting an end to others contracting this disease. Thank you.